It's no secret the pandemic has led to a lot of problems. Several studies suggest that Americans started drinking more as a result of the pandemic. Now, as KVUE's Pamela Combe tells us, this spike might be the reason the liver transplant list is at an all-time high.
After a long week, cracking open a cold beer is one way many people wind down.
Alcohol really makes us feel good.
But during the pandemic, alcohol became more than a way to unwind. University of Michigan clinical psychiatrist Scott Winder says alcohol sales soared this past year, meaning people drank a lot and many of them struggled to stop.
The injury to the liver is silent. So many people don't really understand how dangerous how much they're drinking is.
The dangers? Well, researcher Jessica Mellinger says a recent study found there was a 60% increase during the pandemic in the number of patients who got on the liver transplant waitlist for alcoholic hepatitis.
We're really seeing a lot more patients coming in with this very advanced alcoholic hepatitis, kind of advanced alcohol-related liver.
A disease that causes liver inflammation, one that can take only weeks to develop if not drinking moderately.
Typically happens with that is someone is drinking usually really heavily. So we're talking like 5, 6, 7, 8, 9, 10 drinks a day or more.
The pandemic made these habits hard to change because
pandemic was really the lack of access and the sudden kind of stop to a lot of sobriety and recovery programs.
Which makes sense why there was also a 50% increase in the number of people who received a transplant for alcoholic hepatitis.
People will be like, oh, I just have 1 to 2 drinks, but actually they're having 4 to 5. So you put all that together, plus the pandemic, it's not surprising how many people's livers get sick.
In Austin, Pamela Combe, KVUE News.